This is a case of malignant osteopetrosis, and since birth, he was failing to thrive. He was dropping his centiles, his head circumference was down by 25% from what should be the normal growth curve. He was struggling to feed. He was an ill baby, poor weight gain, poor growth. On examination, he appeared to nod his head a lot, so there appeared to be some weakness in the head as he was trying to keep it up. He looked thin, he looked fragile, and his right eye turned inwards, and he had a large palpable spleen. And the problem in this condition is that the osteoclasts are not breaking down bone. So the osteoblasts are putting down bone and are laying it down inappropriately, so that it becomes denser and denser and denser and bigger, but it doesn't really serve its proper purpose. So when there's no resorption, bone accumulates. And this can be seen on an X-ray, where the bones look just much, much thicker and denser than normal bones. Now, those who are ahead of the game may well ask, you're treating a baby, so what do you do in that situation?
Today's guest is Dr. Gabriel Blass in Scotland, who also featured in episode 132. Gabriel will be sharing with us today an incredibly fascinating case of how homeopathy was able to help in a genetic disorder called osteopetrosis. And in this, he also used some AI to help him find a remedy, and he also used a homeopathic remedy made from a pharmaceutical medication to get incredible results for this client of his. Now, he does have some slides, so if you are watching on YouTube or Rumble, you'll be able to watch those. You don't need them to be able to enjoy the audio, so if you're just listening on podcast, that is totally fine. And then also go check out Dr. Gabriel at homeopathy-glasgow.co.uk. Thanks so much for listening.
Welcome to the Homeopathy Hangout Podcast, where we discuss all things homeopathy from around the world. And now our mum and your host, Eugenie Kruger.
Hello, homies. Today, we have such a great guest for you that I was shocked to realize we have not had since 21st of November 2022, episode 132 on medical astrology and homeopathy with Dr. Gabriel Blass. Welcome to the podcast. Welcome back, I should say.
Hello, Eugenie. What a lovely, energetic welcome. I'm delighted to be back.
Oh, how has that happened, Gabriel, that so much time has passed? I couldn't believe it when I pulled up your name and I'm like, 2022, how is that possible? Well, you're the astrologer.
Time travels fast. Yes, time travels fast. And with a busy world, the rate of change is just so fast and the older you get, everything moves faster and faster and faster, and you blink and you miss it. So,
oh my gosh, it really does feel that way. But anyway, let's not do this again. You need to be coming back, at least every few months and giving us some updates, because I love learning from you. And plus, your accent's so great. I can listen to it all day long anyway, whatever you talk about. But recently, I listened to a really great Zoom that you did on how you were using AI in a case. Now, it's not even the elephant in the room anymore. It's front and center. AI is here to stay. Homeopaths are using AI all over. If you're not, you're falling behind. Students are using AI in their assignments and in their rubrics and repertory and case taking and analysis. Home users are using AI to acutely prescribe. But, we need to use it wisely and in the right way. And you are going to present a great case for us exactly of how you have done that. And I hope this will be like not a beacon of light, like maybe like what's the word? A guiding staff or something. You know what I'm trying to say? Like something that we can hold up to measure against, like, how are we using this great tool correctly?
Yes, it provides one method of using AI, but I have to say you require a lot of discernment with AI because, for example, I wanted to find out a little bit about Yakir ancient plants. Mm-hmm. So I put that in a ChatGPT, and what came up was a load of rubbish. There were lichens thrown in, all the groupings were wrong. And it just sometimes hallucinates. And if you're going to make clinical decisions based on that, you have to go back to your sources. You have to double check that everything is right, because at the moment it can spout absolute wonderful stuff or complete rubbish. And it's up to us to be discerning enough and wise enough to be able to tell the difference. So it can be very helpful, but you can also fall flat on your face if you're not careful.
Absolutely. Well, for those listening on audio, that's great. Gabriel is going to share some slides with us, which is great if you're watching on YouTube or Rumble. I don't like to say YouTube because, they took my channel down a couple of years ago. They did put it back a few years later. But if you're watching the video, there are going to be some slides. But for you listening on audio only, you're not going to need the slides in order to enjoy this presentation. So just giving you a heads up. Gabriel, the floor is yours. I can't wait to hear this because, I don't mind that it's a second time for me because you always pick up extra little bits when you get to watch somebody like you speak again. So go for it.
Okay, this is a case of malignant osteopetrosis. And the mother of this 4.5-month-old baby at presentation phoned me up and says, "Can you help me? I've got a child with osteopetrosis." Now, at the time, I had heard of osteopetrosis before, but I didn't know that much about it. So I said, well, it's some sort of metabolic problem. Homeopathy should be able to offer something useful. When I saw the child, though, in March 2024, I realized that this was quite a serious situation. He was born 38 weeks. He was a bit breathless at discharge, so he was given antibiotics. And it was also discovered to have low platelets. And since birth, he was failing to thrive. He was dropping his centiles. His head circumference was down by 25% from what should be the normal growth curve. And he was struggling to feed. He was an ill baby, poor weight gain, poor growth. On examination, he appeared to nod his head a lot, so there appeared to be some weakness in the head as he was trying to keep it up. But otherwise, he wasn't distressed. He looked thin, he looked fragile, and his right eye, it turned inwards, and he had a large palpable spleen. The mother, who was a healthcare professional, explained that he had had several tests, and there was indeed low platelets, enlarged liver and spleen, raised liver function, and ALK-Phos, which is alkaline phosphatase, which is an enzyme that profiles bone turnover, was very high, and calcium was borderline low. So we know we've got an ill child with metabolic problems, and what are we going to do? So she told me that the chest x-ray suggested that the bones looked abnormal and there may have been fractures of the rib cage. And this is certainly not a case of deliberate harm to the child, that this was part of the metabolic condition. And a provisional diagnosis had been made of osteopetrosis, and the child was awaiting genetic testing. So I think at this point it's worth explaining what osteopetrosis is. It's derived from the Greek, and osteo meaning bone and petrosis meaning stone. So it's a group of inherited diseases that where bone develops abnormally, and there's a problem with bone remodeling. So bone accumulates, the bones get much denser, but at the same time, they're much more brittle, and they can eventually completely obliterate the bone marrow, hence the low platelets, can grow abnormally at the base of the skull and start pinching off the nerves that come out of the skull. And that was the reason why the child had an inward turning eyeball, because the second nerve, the cranial nerve, the optic nerve was affected. And it can lead to an enlargement of the liver and spleen because the body uses different areas to try and make blood cells because the bone marrow has been, it's in the process of being obliterated. So there are different types of osteopetrosis. Some are autosomal dominant, some are intermediate, But the one that we're concentrating on today is the malignant form, which is really the full fat form. It's called malignant not because it has anything to do with cancer, but because the disease is very serious, it progresses quickly, and it usually causes an early mortality between the ages of 2 and 5. So we're dealing really with quite a serious condition. So let me explain a little bit about what happens with bone. I'm showing an example of a long bone like a femur, and there's cortical bone on the outside, which works like a tube and gives the strength, with bone marrow in the middle, which makes it quite light. And that allows the bones to be light, so you're not dragging a huge weight. It's optimized for strength and lightness, basically. And this is achieved by a constant process of remodeling. So when you wake up every morning and you feel your arms and legs, they look exactly like they were the day before. But inside, at cellular level, there's a continual turnover of bone. So bone is laid down and bone is broken down, and that occurs dynamically right through the cortex and the bone structure. And this allows for the bone to be remodeled so that the vector forces of gravity going through the bone can be adjusted to as the bone grows, or as if there are changes. For example, if you break one leg, the other leg will remodel in order to maintain the strength because there's a slight change in the alignments of the bones. So that happens continually and dynamically throughout life. Later on in life, a little bit more slowly, but certainly in childhood, very, very quickly. And in the first year of life, nearly 100% of the skeleton is replaced. So it occurs at a very fast rate because there's very fast growth. So the purpose of remodeling, as I said, is to maintain the mechanical integrity of the bone, to repair any micro damage that takes place from daily stresses on the bone, to adapt to aging and to changes in physiological needs, like all the skeleton is a strong source of calcium should more calcium be required, and also to repair fractures. Okay, now the way that remodeling occurs is through two types of cells: osteoclasts that break down bone and osteoblasts that build up bone. And so it's a dance between the two of them. And the problem in this condition is that the osteoclasts are not breaking down bone. So the osteoblasts are putting down bone and are laying it down inappropriately so that it becomes denser and denser and denser and bigger, but it doesn't really serve its proper purpose. So when there's no resorption, bone accumulates. And this can be seen on an X-ray, where the bones look just much, much thicker and denser than normal bones all over the skeleton and in the skull as well. And this is what then starts blocking the holes through which the blood vessels and nerves exit. But the blood vessels are more squidgy. With nerves, it's more difficult. So back to this case, and this child had a large spleen. The drop in platelets wasn't bad enough that there was any bruising or purpura in the skin, but still it alerted us to the fact that things are not in a good shape. So we're dealing with a potentially devastating diagnosis, and I took the full case as best I could, and I did an analysis. I did quite a wide analysis with lots of rubrics, so I wouldn't miss any important remedies. And then what I do if I see a patient face-to-face is I like to do muscle testing. Once I've done the full analysis and I've chosen my short list of remedies, I can muscle test the patient, and that's a way of asking the vital force whether they think that whether my brilliant or not so brilliant remedy choices will actually have an effect on them that is useful.
That's the thing. It can sound really good in our head and on the repertory.
Yes.
You think, yes, I've got it. But
Yes.
then it's just, they come back and it didn't do anything. It's great that you use
Yes.
muscle testing. That's so wonderful.
Yes. And like you say, sometimes you can be sadly deluded because it looks brilliant on paper. But the way I test is blind, so that I don't know what I'm testing. And sometimes I am quite surprised as to how my favorite didn't come up, but other remedies came up. And then when you look at it again, you can see, okay, it's a slight change in focus and it changes the whole case.
I have to actually say, after I watched you do this webinar the first time, I actually went to go and read this article in hpathy.com about, how to do it. Because I have a pendulum. I hardly ever use it. And, I've tried to do muscle testing and things. And I keep thinking I really just need to hone one of those skills. So I have an additional tool just if I'm, tossing up between a remedy. But it's great that you've got that resource there. And for our audio listeners on the podcast, you can go to hpathy.com and just search in there a pressing matter which changed my practice. So there's an article there by Dr. Blass.
It takes a little bit of practice because you have to get used to just how hard to press and be consistent with that so that you can tell the difference when there's no remedy or when there is a remedy. Now, those who are ahead of the game may well ask, you're treating a baby, so what do you do in that situation? And it's quite amazing because the energetic pairing between mother and child is so great that you can actually use the mother as the proxy. You have to do a couple of additional control tests just to make sure that the connection is real and not spurious, but you can then test the baby through the mother, and that's what we did in this situation. So the short list of remedies that came up for testing, as you may imagine, involve remedies that have to do with bone metabolism, like calc carb, silica, calc phos, calc arsenicosa, calc fluorica. I also tested cyanothus because the spleen was enlarged, phosphorus, again to do with bone metabolism, medorinum because of the excessive bone growth, and Hecla lava. And I tested them all in a 200. But only 3 remedies came up strongly: cyanothus, Hecla lava, and silica. And then what I do is I test to see whether they're compatible with each other. And cyanothus wasn't compatible with the other 2. But when I started to think about it, the enlarged spleen is actually a protective mechanism from the body, so I don't particularly want to try and reduce it. So cyanothus was omitted.
That's so interesting. And I love that you've gone that extra step to actually just test the remedies against each other, because I will often prescribe 2 or 3 remedies at a time. But, I didn't really think about testing whether they're compatible with each other. And it makes so much sense what you've just said.
Yes, and sometimes they are, and sometimes they're not. Mm-hmm. So we started, again, I test frequency and potency. So we started with Silica 200 once weekly and Hecla lava 200 once weekly.
Almost hard to believe the once weekly, considering the seriousness of the complaint, right? I would have thought it would need more than that. It's quite unbelievable.
Yes, I test once daily. If they're strong for once daily, I'll go on to twice daily or 3 times daily, but it seemed to be once weekly. Even though there's a lot of metabolic stagnation, the signal that was required, I suppose you could overwhelm it. And in this case, the baby wasn't happy with more than that. So that's what we went for.
Amazing. And I guess they've still got such a strong vital force. They've just been born. There hasn't been too much suppression or anything.
Yes.
It's actually just really cool to see.
Mm-hmm. So the second consultation was 10 weeks later because it takes a while for bone turnover to occur. And the mother reports no obvious changes. However, there's less perspiration on the head. The child has been feeding better, growing and gaining weight. So something is changing. The liver function tests are much improved. The parathyroid hormone fell from 45 to 16. And the alk phos dropped into the hundreds instead of the thousands. So we are getting some metabolic changes, which have been confirmed by blood tests. The platelets and hemoglobin rose, which is good, but then fell again, which is not so good. So only transitory changes. I think the body was trying to do something, but not quite succeeding. The child had been to ophthalmology and the optic discs were difficult to visualize, but there seemed to be some possible pallor on the right disc. And this could account for the abnormal movement of the eyeball that we saw in practice, where the eyes tended to go in the way medially. And then genetic testing confirmed malignant osteopetrosis. And there are a number of variants, and he had the TCI-RG1 variant. And this was reconfirmed independently by another lab in another country. So the diagnosis was not in doubt at all. So in the slides, I'm showing confirmation, the two results. So the mother refused bone marrow transplantation, which is the only available treatment, because the survival rates locally had been 0. So not a good outcome. So no pressure. It's up to me to try and do something about it. So there was some clinical improvement, but there was also evidence of progression. The cranial nerve was still involved, and probably a change of remedies was required. So I did muscle testing again. I added a couple to muscle test. One was DNA, deoxyribonucleic acid, Merck, and syphilinum, because we're talking about more syphilitic remedies, and tub-bob as well. Tub-bob as well. And muscle testing this time, he seemed to need 4 remedies. So he got syphilinum 200 every 3 weeks, Hecla continued weekly, Silica continued weekly, and then DNA, or DESAC as a summary, weekly as well. Now, I don't usually prescribe many remedies at one time, except where it's indicated. And here it seemed to be indicated. There's a lot that we're trying to deal with. We're trying to deal with a very strong genetic loading. We are trying to deal with the obliteration of the bone marrow as well as metabolic problem. So,
do you know what? I've never actually read up on how the Remedy DNA was made. I really should go and do that. But I have used it several times in genetic disorders with really good results. It is such a good remedy. I think it's actually underused.
Yes. And proven by O.A. Julian, a French homeopath.
Yeah, I've got that little book on those. Oh, actually, no, it's a variety of remedies, but I was surprised. I found a few like random remedies in there that I didn't even know existed back then. But that is a great book. I'm wondering, it must be at home, but yeah, good one. Does he say in there how it's made?
Yes, it's from, well, I know the RNA one, which is very relevant in COVID times, is made from Saccharomyces, basically brewer's yeast. So it's brewer's yeast RNA. I think the DNA is something similar.
Interesting. I often use DNA and RNA together as well. Sometimes I'll put the two together, like DNA, RNA. Yeah, interesting.
I've never used them together. Why together?
I don't know, just covering my bases, especially during COVID. I was like using the two of them together a lot. Just, yeah, I figured I'll just throw everything at it that I can with all of these weird things. And all. I was actually wondering whether a baby's parents had the COVID vaccine, because I certainly feel like I'm seeing incredibly weird things in my clinic the last few years since.
Yes, but this is a situation where it's like 100% genetic.
Okay.
So it's going to manifest anyway. There's not so many epigenetic factors involved. So whether they had the vaccine or not, whether they had a healthy diet or not, it might affect the pace of progression. But this child, it's an autosomal recessive condition. So he's got 2 faulty genes. So in theory, cannot make the right proteins. So it's always going to manifest.
Incredible, eh?
Okay, so third consultation was 11 weeks after that. He's feeding well. There's some weight gain. He was started on vitamin D. His bloods are stable. His abnormal liver function tests are lowering. His parathyroid hormone is fluctuating, which means there's a lot of bone activity, but there's some stability. So this time I did some more muscle testing. I also muscle tested silicon, the element, as opposed to silica as well, just in case that was relevant. And this time he required syphilinum 200 monthly and still silica 200 weekly. 14 weeks later, mother says his muscles are noticeably stronger, and the muscles will have a reflex inhibition if they cause bone pain, just in order to protect the bones. So the fact that the muscles are stronger suggests that the bones are stronger. The fact that he's attempting to crawl now suggests that the bones can weight bear now, which is really, really important. So there is some improvement in the bones, because before, initially, even breathing, the act of breathing seemed to have fractured the ribs. So this child would not be expected to crawl, to sit up, to stand. So the fact that he's attempting to crawl means he's probably not experiencing any pain, and the bones are strong enough that he's able to do that, which is really important. And he's able to sit up. So those are all good signs. He's feeding well, he's gaining weight, but the patient managed to pull out a tooth. So the tooth sockets are still very abnormal. And the spleen was very enlarged again, and the platelets dropped. So that's quite an ominous sign. So even though generally the remedies have been supportive and have stabilized the metabolic problems, what's going to kill him is an obliteration of the bone marrow. And a larger spleen and a drop in platelets does not bode well. So the disease is clearly progressing, and the mother is now considering bone marrow transplantation abroad. And marrow donors are actively being sought. So at this point, a rethink was definitely necessary. So in the interim, I muscle tested, changed to calc phos, and increased the potency of Silica to 1 m weekly, and the calc phos was 200 monthly. So what to do? At this stage, I felt I'm not going to get the solution intellectually. I've looked at all the remedies. I've analyzed it in great detail. On this horizontal level, it's not going to get me any further. And if I don't, we're all in trouble. So at this point, I thought, okay, what about let's dance in the moonlight and sing incantations? Let's draw on some other source of inspiration at a more intuitive level. So here in Scotland, it's too cold to dance in the moonlight. But we do have a very handy incantation, which is similia similibus curentur. Like cures like. So the thought occurred to me, what needs to be cured here? And obviously, it's the genetic illness, it's the genetic mutations. But we can't alter the DNA of every single cell in this organism. So what can we do? So there are 6 gene mutations associated with this illness. We know which one is affected. It's TCIRG1. And there's plenty of osteoclasts, but they're not working well. So if we are going to look at something that, along the principles of like cures like, then I need to understand in detail what's happening here. So I used ChatGPT, first of all, to educate me. And basically what's happening is that there's the normal number of osteoclasts, but they're not able to resorb bone. The way they resorb bone is on the underside of the cell, on the belly of the cell, which sits on the bone. The cell releases acid, which dissolves the mineral, the bone mineral, the hydroxyapatite, reabsorbs it, and then new bone can be set down. And the problem in this situation is that there's a protein missing that is necessary in order to allow the osteoclast to release the acid. So it can't acidify, so it can't dissolve the bone. And further, so if you want the underside, the belly of the cell in contact with the bone has a ruffled border. This increases the surface area so it can be much more efficient. But that doesn't make any difference if you don't have any acid production. So the question is, if it can't acidify, the next question to ask GPT is, are there any drugs that can replicate the osteoclastic malfunction present in this condition? Basically, is there something in nature, artificial, synthetic, or whatever, that can cause this? And ChatGPT said, no can help. Computer says no. There's no drugs that replicate exact mechanism. So I said, okay, are there any substances that can resemble or mimic what is happening in this illness? And ChatGPT says yes. Well, for me, similar is good enough. It doesn't have to be identical. So there was a list that it compiled and it told me about, and I'll go through a few of them. The biphosphonates, like alendronic acid, which are used in osteoporosis in order to prevent bone resorption, is one candidate. Again, in an attempt to make the bones stronger. But if there's no remodeling and you just lay down more bone, it doesn't necessarily mean they're going to be stronger. Then there's another group of drugs that are used in the treatment of osteoporosis, and they're called rankle inhibitors, denosumab being an example of that. Then there's a group called cathepsin K inhibitors. What's really interesting is that the nonsteroidal anti-inflammatory drugs like aspirin belong to this category. So aspirin, you can get as a homeopathic remedy. So I'm thinking, which of these can I possibly get as remedies? Then there's some experimental drugs, which there's not a chance that I'll be able to get them in a short time as a homeopathic remedy. Then, interestingly enough, statins come up. They affect osteoclast differentiation. So they disturb the production of osteoclasts and the formation of osteoclasts. So again, it's not exactly the same mechanism, but the outcome is the same. And it begs the question, with hundreds of thousands of people taking statins, what is that doing to their bones? Then microtubule inhibitors was another group, and colchicine, which is a homeopathic remedy already, is one of them. And then another group was proton pump inhibitors like omeprazole, again, which are used widely. What effect is that having on the bones of the general population? But omeprazole and esomeprazole reduce the acidity around osteoclasts, just like they reduce the acidity in the stomach. So it mimics the problem that we have here. So basically, the long and short of it was that I could obtain 6 remedies, which I ordered from the pharmacy. I ordered them all in a 30C potency, and the short list of these 6 is alendronic acid, denosumab, omeprazole, atorvastatin. I used colchicum instead of colchicine because I already had it, and aspirin. So in the interim, several investigations were carried out, and the mum told me at the 5th consultation that an ultrasound confirmed the splenomegaly. Well, we knew that because I could feel it. It was big enough, it was very large. The MRI revealed thickening of the skull, but no hydrocephalus. And the ophthalmology revealed that the right optic disc was pale, so it was being nipped. The left optic disc was slightly pale, so not as bad, and there wasn't any damage to hearing or any heart problems, which is good. So I muscle tested those 6 remedies that I had, and only 2 came out strong, atorvastatin and aspirin. But it was obvious to me that atorvastatin tested much stronger than aspirin. So I thought, okay, let's start with atorvastatin. Now, atorvastatin is used nowadays to lower cholesterol, very much in vogue. You might have heard of the name through that. So muscle tested again, all the candidates, and calc-phos 200 was required twice weekly, and atorvastatin 30 twice daily. So I saw the child 4 weeks later, and I was surprised because there was something coming off the child that told me this child is better. He was improving, he looked healthy, he looked strong, he was standing, so the mechanical integrity of his bones was much better. He was attempting to walk, and this is all in 4 weeks. Remember, a child has a very fast bone turnover, so they can turn it around very, very quickly. He was now reaching all the milestones for his age. His spleen had reduced in size. That's a very good sign. The optic nerve pallor hadn't progressed, and his eyesight, in fact, had improved. And this was assessed by visual evoked potentials, so measuring electrical activity in the occipital cortex that registers sight, because the child can't tell you. So there is a regression in the optic nerve problem, which is great. So we're going in the right direction, very encouraging. To be able to stand and attempt to walk means his skeleton is growing well now. And again, the spleen reduction, the bone marrow is becoming more active. So some of the overgrowth of bone has been resorbed in some way. How, we don't know yet, but resorbed in some way, and it's beginning to reverse the situation. This time, when I muscle tested, Atorvastatin 200 was required, so we're going up twice weekly, and that was the only remedy that was required. 6 weeks later, he's now standing independently, can sit up himself, spleen is going down further, muscle tested, Hecla, Lava 200 once weekly, and this time he didn't need Atorvastatin. I think he had enough for the moment. And it was DNA that he required, at 200 every 3 weeks. Then 6 weeks later, he's standing without support. He's moving around, holding onto objects. The mother says he's desperate to run around. So he kind of holds onto the sofa and runs around. And basically, the child, to me, appeared completely healthy, except for a right eye that turned medially intermittently, so not the whole time. When I muscle tested, we had to go up in strength, so we went to Atorvastatin 1M, and he just needed a single dose. So go figure, this is something I couldn't have worked out myself without the muscle testing. Hecla Lava was now needed in solution, because I also ask, is it in tablet or solution? So we're going on to the plussing method once daily, and now sulfur is required in solution once daily as well. So at the 9th and the final consultation, which was 5 weeks later, there were no issues at 1.5 years old. The child can sit, stand, and walk, holding on to one finger from the parent by himself. He runs holding on to the sofa. He's got great stamina and determination. When I muscle tested, again, he required Atorvastatin, 200 plus once daily, and sulfur plus once daily. So for me, this response suggested that the homeopathic treatment in some way was able to reverse the genetic defect. We can now start theorizing about how and so on, but in terms of proof of concept, this has taken place, and I was still shell-shocked at that point. I was delighted, but in a way it opens more questions than it answers. So at this point, with a healthy child, the mum had a difficult decision because a bone marrow donor was found in Turkey, and the mother had to decide whether to go through with that or not. We discussed it at the last consultation in great detail. Her feeling was that he might require homeopathic treatment for life. And if the homeopathic treatment should fail and the clinical picture reverse, then he's much less likely to be accepted for bone marrow transplantation if there's lots of cranial nerve problems, etc., etc. Plus, they would be irreversible at that point. So she took the difficult decision to go with bone marrow transplantation. And let's just move on. Post-transplant, she told me he had his hematopoietic stem cell transplant on the 18th of June, 2025. He has done so well. He is walking. The only thing, and he's fine, the only thing that keeps him in hospital is his platelets are still a bit low, which sometimes happens after transplants. And she honestly believed that homeopathy had a huge input because that child went into the transplantation process really, really healthy. A lot of them go in very, very poorly, and so the outcomes are not so good. So Atorvastatin First of all, we haven't used it before in potentized form, widely anyway. We don't have a classical picture for it, but through this unconventional methodology, we found a way of using it, and that all the rubrics that were involved in that case now, at least in Radar Opus, should have Atorvastatin in them because I sent them to Luke.
Great.
And the interesting thing is that this has managed to change gene expression in a condition where there was no normal gene. So it brings up a number of questions. The first one for me is that we've been looking as DNA being the blueprint of the person. So it tells you how everything develops. But if that's the case and you can't change the blueprint, how has this child got better? So I'm thinking of looking at it as a different model. DNA is a hardware. Without it, you can't make proteins, you can't build the body. So you've got the hardware in place. But what runs the hardware is the software. What is the software? The software must be the vital force. Because otherwise, we have influenced the vital force and it has changed gene expression in some way. So the vital force is a software and it's amenable to homeopathic treatment because homeopathy works at the level of the vital force. How the body then figured out to be able to either bypass or synthesize the correct genes is not understood at the moment. But if we consider that about 90% of DNA has genetic information that we don't know what it codes, we have a lot of leeway there. And if we can stimulate the vital force in the right way, we are now coming into an era where we can treat, but where we potentially can treat genetic illnesses if we can find a simillimum for each one. That's the first thing, which I think is huge. And I think it's particularly important in the age of COVID because a lot of children that were born when the mothers were vaccinated in utero have the potential of the mRNA sequences being incorporated into DNA, and therefore the spike protein becomes identified almost as a part of self. And so there will be a small proportion of people, even though it's a very small proportion, we're talking about huge numbers because of the billions of people that were vaccinated. There will be a small proportion of people who, when they first encounter a coronavirus infection, they will consider it as part of self. They will not be able to produce an immune response for it and will probably die very, very quickly. So this new methodology might, in the future, play a really important role in trying to help those people.
Wow, that's something I'd never even considered, but you're so right. Like just thinking into the future, this really is the potential of homeopathy.
Then the other thing is in single gene defects. Would it be fair to say that something like Atorvastatin would work for all situations that have this particular gene defect? Because normally when we're treating people, we have to match the simillimum to the person. We've got their miasmatic loading on top of their genetic constitution, on top of all the epigenetic factors which influence health and disease. So there's a huge number of remedies. There's so many permutations. There's a huge number of remedies that are required. But in this case, it's a single gene defect, which more or less will have the same kind of effect with minor variations on all people. Now, I wasn't treating with atorvastatin the genetic expression of it. I was addressing the actual genetic mechanism.
Yes.
So it could be that for this variant, you need atorvastatin in all cases. We don't know yet. And
Well,
for the other 5 genetic variants, there might be just one remedy that's required. And then if you widen it to all single gene defects, it might come a time where you find a remedy for each particular one of those.
You're giving me goosebumps, absolute goosebumps. I just want to put it out there. Any of our listeners, if any of you know anyone with osteopetrosis, send them to Gabriel, because it'll be amazing if you can treat a few of these children and, see if this is maybe something to go down for sure.
It's
I actually,
not very common, but yeah, a condition. Sorry.
While you were speaking, I quickly had a look on my socials, because I posted a couple of years ago about a genetic condition that I treated, which that was one of my most incredible aha moments, because I really did not know what can homeopathy do, because it's a genetic condition called Noonan syndrome, which, they have specific facial features, but also it affects their growth, and the children that have to go on, not have to, but often go on growth hormones at a very young age. So I said to this mum, I actually treated her for cyclical vomiting syndrome, which was vaccine induced since she was a baby. And then I said, well, let's see what we can do with, her growth, because she was like, I think 11 or 12 at this time, but she looked like a 5-year-old. And I was like, well, let's just see what we can do. And when you finish screen sharing, I'll share my screen and show you the image of the growth, that we achieved for her, which was one of the most, haven't we just got the best job in the world? Because to see things that the medical profession had given up hope on, and people have been told there's nothing that they can do. And with homeopathy, we might not always be able to help you, but we can always try. There's always something that we can do. And honestly, more often than not, it really blows your mind.
And before we used to think, okay, it's genetic, we won't be able to do anything about it. I think we need to abandon that. And, they often say that our patients are our best teachers. And in this case, it certainly has been the case, because I have learned so much from this child.
So grateful to get to view this case again. It was almost better the second time round. Thank you. I feel like I need to give you a round of applause, because there's so much in this, from using the AI to help, really break it down. What is it that needs to be treated? What is the thing here that's actually, causing this issue? And then, from using your muscle testing, all of it, the repertorization.
It's quite ironic, because I felt, this is an important case that needs to be published in peer-reviewed journals. And I submitted it to 2 different journals, and it was rejected. And the reason for the rejection was that it had no references for the methodology. But it's a catch-22, because it's original methodology, so there's no references for it. And they missed the point completely, that this is a momentous change, a hint of what we can do in homeopathy, and they're getting caught up in references rather than looking at the whole picture. So I'm quite frustrated at the moment. I hope that someday I'll be able to publish it, but it seems that they're caught in, having to have references, and in a small way, it makes me get a taste of what it must have been like for Hahnemann coming out with completely new methodology that was never accepted at the time, and how he broke new ground and created the whole system of homeopathy, and how much resistance he must have had.
And to keep going, right? Despite that, or anyone like Gabriel
all his life, yes.
So many great artists that never actually got to experience, the highlight of their work in their lifetime. I often think how frustrating that must be. But I always believe everything happens for a reason. And maybe if it had been published in the journal, you might not have been, wanting to get it out there. And now that it's on the podcast, hopefully more people who don't read homeopathic journals will be able to hear it, and practically, hopefully more lives will be touched by this work that you've done. So.
Because I would encourage other homeopaths not to be intimidated, to really try and give it a go. Never give false promises, because we never know what it's like. We've got cases that seem really, really simple, and then they don't turn out to be simple. And then here you have a very complicated case that eventually was sorted out. So always work with hope, always give it your best go. but don't allow your mind to limit what you can do, because as a homeopath, the potential is almost unlimited.
It really is. I just have to show you this. Look at this. There is
Yes.
1.5 years between these two photos. Isn't that incredible? So here you can see like
Wow.
she looks like probably like a little 5 or maybe 6-year-old, and here you can see it's like a, like a 13-year-old girl. It's just incredible. So, with this cyclical vomiting, she was in hospital every few weeks and, managed to nip that in the bud with homeopathy within, a couple of months, never had to go back. And then with the Noonan syndrome, managed to achieve this incredible growth. And I'm incredibly grateful to her mum, who took these photos out of her own accord, happened to be in the same place, 18 months apart, because, a picture paints 1,000 words and you can't deny the difference in height there. So it's pretty cool.
Super.
Yeah, amazing.
Well done.
We really have
Well
the
done.
best job in the world. Yeah, well done. You too. High five. Gabriel, I really appreciate you sharing this. I'd also love to know, what other ways are you using AI in your clinic? I mean, this was a really actual useful way of using it. And I mean, we don't know all the drugs off the top of our head. So even just using AI and asking, what drugs can address this, and then, getting a variety of options out there.
I actually don't use it that much. We have tried and tested methods that work very well. And so I would reserve AI when I'm really, really stuck.
Well, clearly you've done a great job with it. So I applaud you. And I'm incredibly grateful that you've come to share this with our audience. Thank you so much. And please don't wait so long before you come and visit us on the podcast again.
Okay.
And I just absolutely want to say to our listeners, go and listen to episode 132 as well, where Gabriel tells about how he discovered homeopathy, and we talk about medical astrology and a whole variety of other things as well. So you're going to enjoy that episode just as much. Gabriel, thank you for your time. I really appreciate it.
It's been a real privilege. Thank you.